Placebo Effect, Its Biomedical Foundations, Chapter 3, Placebo Therapy, by Professor Gershom Zaitchik. According to the common wisdom, many diseases are self-healing, like common cold, which you get rid of in 1 week or 7 days. On the other hand, chronic diseases heal by themselves only seldom. Nevertheless, even in a chronic condition, healing processes operate. A disease is a manifestation of two processes. One, external process that interacts with the body, which is called here disease driver, and healing processes mobilized by VOB. Example: two processes operate in inflammation. On one hand, the external driver is a bacterial infection, which is regarded here as external driver. Healing processes are, for instance, in the immune system. The stronger the driver, the more serious is the disease, and vice versa. These two processes operate also in a chronic disease, although the driver may not be so obvious, like in rheumatoid arthritis, which is a chronic systemic inflammatory disorder. There is no known cure for rheumatoid arthritis. The goal of treatment is alleviating current symptoms and preventing future destruction of the joints. In other words, treatment goal is to slow down disease progression. All drugs in rheumatoid arthritis have grave side effects and with time become less and less effective. With time, rheumatoid arthritis resists most treatments, and glucocorticoids remain the only treatment at last. Consider a patient who requires adrenal steroids or immunosuppressive agents. Prolonged treatment is accompanied by grave side effects. Several studies, however, have shown that by interleaving placebo in the treatment regimen, the total amount of drug can be reduced and the patient suffers less side effects. So, we treat the patient daily for 3 weeks with steroid tablets. On Monday of the 4th week, he receives a placebo tablet instead. We observe the patient for 3 weeks, and if his condition remains stable, he will get on the next Thursday the second placebo tablet in a week, and so on. The first 3 weeks serve for conditioning VOB, and when it establishes an association between the effect of the steroid tablet and placebo pill. After the association has been established, placebo pill will activate the same processes like a steroid tablet. Let's compare this setup with Pavlov's experiment. The steroid pill is here an analog of the digestive system, and the placebo tablet serves as a ringing bell. Note that you cannot start with a placebo alone, since VOB will regard it as a pill without a message, inert pill. Only conditioning trains VOB to regard placebo as a message or stimulus. This message is specific and activates only processes that VOB was trained for. It will not activate any other process. By the same token, Pavlov's bell will not activate kidney processes. The number of interleaved placebos depends on the patient's condition. In order to achieve such an effect, it seems necessary to cheat the patient. Otherwise, the placebo is useless. So the entire procedure seems unethical. Not at all. Obviously, the patient has to be told what his condition is and how he is treated. Yet our explanation depends on how he is told. If you adhere to Dorland's definition, placebo treatment is indeed a fraud. In the previous chapters we have realized that this definition is misleading. Placebo is a message to WOB to activate healing processes in rheumatoid arthritis. As clinician or observer, you have no doubt that interleaving is vital for the patient. On the other hand, this procedure is considered as fraud, since medicine regards the organism as a complex machine with a soul, and a machine cannot be treated with a dummy pill. You wonder, what's in this metaphor? Suppose that you adopt a different one, and the ethical dilemma will be gone. For instance, the organism might be a complex machine with a soul that heals its malfunctions, and the inert pill accelerates healing. Many so-called ethical statements in medicine are nourished by false metaphors. In a previous lecture, I demonstrated that the theory of medicine is incomplete, and its proclaimed ethics are somewhat doubtful. Medicine is preoccupied with ethics which are twisted so as to make human experimentation ethical, like in clinical trials, which I shall discuss in a separate lecture. So we still face the question what to tell the patient. It all depends how placebo phenomenon is interpreted. In order to examine whether interleaving prolongs the steroid effects, we may choose a measurable clinical manifestation in the body and correlate it with placebo interleaving, like in this Gedanken experiment. We might even find that placebo interferes with steroid clearance from the blood, inactivation. In other words, placebo may prolong the biological half-life of the steroid. So we tell the patient that the treatment involves two medicaments. The white tablets contain a steroid, and the blue one a non-steroidal substance that acts as a steroid promoter and prolongs its effect. However, the interleaving reduces, therefore, steroid side effects because the patient gets less steroids. The patient is suggested to control the interleaving procedure together with us. Every 3 weeks, she will replace a white tablet with a blue one and observe how she feels. If she feels worse, she will return to the previous schedule. Otherwise, continue to train her Bob. In this setting, patient reports to us WOB messages to the mind. So if WOB is silent, it accepts interleaving. Otherwise, it will complain. So there is more to it. Suddenly, if the patient feels that she is in control of her disease, not a disease anymore, but a condition which she can handle. Thank you.